Welcome everybody to GoLocal Live, a special Sunday morning episode. We're here in downtown Providence at our studio. Dr. Michael Fine joins us from his home in Scituate, Rhode Island. Dr. Fine, thank you for joining us this morning.
Good morning, Josh. How are you?
Excellent. Obviously, the numbers continue to grow around the world, as well as in the United States. In Rhode Island, the governor announced at a press conference yesterday that the number of coronavirus cases has elevated to 20. We don't think, as logical people, sir, that that's anywhere near the end of this, correct?
Correct. I think we're really at the beginning of this in the United States and Rhode Island. The international national numbers are, we've got 156,000 people infected around the world that we have measured. About 5,800 deaths. In the United States, we have about 2,952 known cases and 20 cases in Rhode Island. But remember, in the United States and in Rhode Island, that's a function of who we've tested. And we've had relatively restricted access to testing itself. So the numbers are going to grow, and that's what we'd expect.
The most horrifying number that I saw, and we're both looking at the Johns Hopkins database that is collecting information from around the world on a pretty much a real-time basis, was the Italian numbers of a 6.8% mortality rate, twice almost any other country, and 3 times the U.S. data to date. What do we learn from those Italian numbers, and how can that help us?
Well, you know, remember, the case fatality rate, which is what you're talking about, is always a function of the number of people who have been tested. And the only people who are tested are people who are already sick. Most of us think that the case fatality rate is going to drop and drop significantly over time, and the Italian numbers don't change that. But what the Italian numbers suggest, and what we're hearing from Italy, is the importance of preparing well, and of having the resources we need to really make sure that the population is well taken care of when people get sick. That's what the Chinese did and did well, and that's what we're going to have to do if we're going to really control the numbers and restrain the number of fatalities. The number of fatalities in that group of people who will become seriously ill, remembering that the bulk of people who get sick are going to have mild disease, and that mild disease won't even need to be seen by a doctor.
Right.
There will be this small subset of people who are more seriously ill, and we have to be prepared to take care of them. We have to be prepared to isolate people who are sick, and we have to make sure that people have access to medical consultation without exposing them or healthcare workers to more disease.
I was at the governor's press conference yesterday at noon. She is much more somber and worrisome than she was at the beginning of this process. She was also very concerned about social interactions, strongly advising people to skip Mass today, any religious ceremonies, and also really urging people, especially students who are out on break, not to have this be a vacation playtime, but to have this be a time of separation. Talk about that. Where are we now? What's the next step for us?
Well, I think people in general, and people in Rhode Island are doing an exquisite job understanding what they have to do and quieting it all down. You know, I keep hearing about the cancellation of everything, and that's a good thing. But we can only achieve so much by this kind of social distancing. In order to really stop the disease, we need to follow what the Chinese did and kind of take it to the next level. That means isolating every person who's sick, because the bulk of the disease transmission occurs not out, you know, sort of at a nightclub. The bulk of the disease transition appears to occur in homes with families. So the art is going to be to develop the capacity to isolate people when they get sick until they get better, remembering getting better is a 3, 4, 5, 8-day process. It's not forever, but during that process, somebody who's sick and in whom we've made the diagnosis needs to be separated and cared for by healthcare workers with who themselves have special garb, so we don't put those healthcare workers at risk.
Many of the people who are self-quarantining now because they have a concern that they're not feeling tip-top, A, have not been tested, and B, are not sure that they have the virus. Is that going to continue, or will we build an apparatus to be able to get testing to a reasonable level?
I'm hoping we'll build an apparatus to get testing to a reasonable level. I'm hearing that that's in the process, but we're not ready to announce it yet. Hopefully there will be a number of testing sites around the state where people can go and get drive-through testing, and I'm hoping we'll hear about that soon. But that's just the beginning of the kinds of things that we're going to have to do and the kinds of changes we're going to have to make to really get ready for this, or to be prepared for it. We probably have 2 or 3 weeks to tie down everything, but we don't have much more than that, and we might have less time yet. The kinds of things we're going to need to do include putting together some fairly substantial new intensive care unit capacity. I'm thinking that we're going to need another 200 or 300 beds. That suggests that, and I'm hoping this is happening, that somebody's looking at reopening Memorial Hospital or other closed wings of hospitals. I think we need to look at developing the space for an isolation unit, a large isolation unit, on the level of 500 to 1,000 people. That suggests to me looking at the the Superman building, or other large empty
Convention
spaces.
center, Dunkin' Donuts center, something like that, where
Something like that, with some physical separation between people. It suggests to me we're going to have to mobilize large numbers of healthcare workers, many of whom are retired or working part-time, and get them to step up and help us and figure out a way to make all that happen. It suggests that we need to figure out a way to allow primary care practices to basically do telephone visits, so that people can call into their primary care doctor rather than be seen, which is a doable thing for many situations. Those are the kinds of changes we need to be making. I think they're getting worked on, but I'd like to see them happen and happen fast, so that we can really get in front of this and reduce the number of people who are seriously ill and who may die from this. Only remembering that 80% of the population who get this disease will do fine and won't have a problem. And that's where we got to have balance. This isn't scary, but it demands deliberate, thoughtful, and precise attention and the marshaling of resources, unlike anything we've done very much before.
Let's talk about Memorial Hospital. There's a petition going around calling for it to be reopened. We've quizzed, sent over questions to the Rhode Island Department of Health, asking them if they've dug into this at all as one of the options for overflow or for isolation, either one of those options. We're waiting to hear a response from that. Is that the most likely? I mean, it was a hospital. It's only been closed for beginning of 19. It's only been closed for 15, 16 months. Is that the best place, ideally, to be able to leverage that space?
Gee, I don't know. I mean, it's there, and it's got things like the piping you need to deliver oxygen. That's important. I mean, essentially, we ought to be developing a couple of hundred extra ICU beds. I'm hearing there are 200 or so ventilators that are in reserve. We ought to find a place to put them into service. Memorial seems like a potential opportunity, but there may be other wings or closed units of other hospitals that might be able to be put into operation earlier. The challenge is that we have a market, not a healthcare system.
Right.
And so the challenge is for the governor to use her emergency powers, consolidate all these healthcare resources, and begin to run this in a coherent and directed way, like a healthcare system, so that we have command and control and can deploy resources in an organized fashion.
One of the issues that's come up almost immediately, Friday it was found that there was a student at Cranston West High School. The school system sent out a request for the students to go into self-quarantine. By late Saturday afternoon, Mayor Fung went on to social media after numerous reports of a complete lack of adherence to self-quarantine by the high school students. Are we going to run into that problem of nice weather, people feeling sort of locked in and begin to want to get out and get back to normal life in a relatively short period of time? In the case of Cranston West, it wasn't 24 hours.
Yeah, I mean, I think we may run into that problem. But I actually think the solution isn't self-isolation. I think the solution is expanding testing and creating actual isolation units so that we make the diagnosis when the disease is present and get people into isolation so we don't sort of hope for the angels of their better natures. That said, we really also need to be thinking about people who live closer to the margin, people who are going to be put in financial distress or other sorts of problems. And we need to make sure that we are stepping up and giving them assurance that we're going to take care of them too, that that they don't have to go to work and they're not going to go broke or lose their house or have their electricity cut off in the meantime. We've got to put those guarantees in place, and we've got to do that soon.
I was at the supermarket at opening time this morning, 7 a.m. Probably about 40% of the shelves were empty or freezers were empty. I spoke to the cashier and checking out. She said Saturday was the busiest day she'd ever seen in her years working there. I think she was a war-torn veteran of that supermarket. How are we going to deal with those issues as the whole country slows down? The supply chain's going to slow down.
I think it's going to happen, and people are going to learn to cope. We are an inventive people. I went out yesterday. I didn't buy groceries. I went out and bought vegetable seeds, and I got ready to plant a big garden because I figure that, I can get lettuce up in, probably 3-4 weeks, and over the next month or two, I can develop enough of my own food supply to take care of myself and my family for a little bit.
I was thinking you were a Cheetos guy, and you were hoarding Cheetos into your house there in Scituate.
Yeah, not so much on the Cheetos, but I will miss fresh fruit if I can't get it. That said, I may have to settle for fresh vegetables, and that's something we can all grow. So right. To me, this is the time to start doing that and thinking about that as much as hoarding supplies. I mean, what's going to happen to the nation's food supply and the nation's toilet paper supply and so forth is going to be what happens. We're going to have to make do with what we have for a while.
If you lived in Wuhan, China, you're in month 4 of this. If you live in Rhode Island, you're still in month 1 of this. What should we expect over the next few weeks?
Well, I think we can expect the gradual increase in the number of cases. Maybe not so gradual. I think we ought to expect a doubling of the number of cases every 5 days. And in the beginning, that won't be overwhelming. But 2 weeks from now, and I haven't run the math, 2 weeks from now, I think we'll start seeing a couple of thousand new cases every week. And nobody should be upset by that or frightened by it. That is what is just going to happen. And it's part of the natural history of this disease. So I expect that more than anything else. I'm hoping that we'll see the rapid use of the governor's executive power and the consolidation of the healthcare system and the creation of a healthcare system, so that we make sure we take care of everyone and do that in a rational way. And that's a good thing. That's not upsetting. And I think we will see Rhode Islanders doing what we always do in a time of crisis, which is reach out to each other, take care of each other, look out for each other, be responsible and be respectful, so that when we can stay home, we do stay home, but we make sure that we're in touch by phone with the people we know and love to make sure everybody's okay.
Dr. Michael Fine, I want to thank you for joining us again today. We'll probably see you back tomorrow. Unless the governor says something big at 12 noon today, we might be calling you back even later today. I want to thank you very much for joining us. For everyone, stay safe, enjoy this beautiful weather, get out for a walk. Stay tuned to GoLocal. We'll have nonstop coverage, as we have for the past few months, covering this issue and how Rhode Island faces it. Thanks, everybody, for tuning in.